You are looking, meanwhile, at the first at-home COVID-19 test approved here in Canada. The company says their tests can deliver results in a period of 11 to 30 minutes. It's already being sold in the U.S. Kelly Brezoczky is the Executive Vice President at Lucira Health Inc. She's with us from Los Gatos, California. Hi, Ms. Brezoczky. Good to meet you and good to have you on our program this evening. Thanks for making the time.
Thank you so much for having me.
Could you start off just by explaining to me and our viewers exactly how this test works?
Sure. The test is actually, we've taken the ability to deliver lab quality PCR results that are typically performed in a centralized lab. And our technical team has been working for over 7 years to put it into a little tiny test unit that can deliver a PCR quality result in as few as 11 minutes if you're positive and 30 minutes to confirm a negative. And it sits just in the palm of your hand. I think you might have an example of one,
right,
but this is how the size of it.
And so it's a PCR. It's important, I think, to distinguish for our viewers. It's a PCR test, which is kind of like the gold standard here. It's not a rapid antigen test, for example.
Correct. It's actually not a PCR test. It's a molecular test. And so it's similar to PCR and delivers a PCR quality result, but it's actually an isothermal molecular test. But it's in the same category of molecular tests, which are quite different from rapid antigen tests.
And this is a single-use test, right? So you kind of order it, and is it the kind of thing you can go to your pharmacy to get? I mean, in the places where it's already approved, how do you envision it best working?
So our test was designed to be a single-use test, right? So you basically when you buy a test kit, it contains everything you need to run one COVID-19 test is in the kit. And so presently our test is only available in the United States, and it's available currently online for $55 US per test in the US.
And so do you anticipate now that it has conditional approval, or approval with conditions, I should say, from Health Canada, that it'll be the same kind of thing here, that Canadians will be able to order it online, and will it be similarly priced?
I would say that's our hope, and we're very excited about our Canadian authorization and looking forward to being able to have our product in Canada as soon as possible.
How soon do you think that might happen?
We're hoping that it can be within the next couple of months. I think our goal is to be able to have our test in Canada by June.
And are there any conversations, I mean, I know it's individuals that would purchase it, but are there any conversations, for example, with government here in Canada about them procuring it, or it be, I'm thinking, for example, I know it's different, but in the UK, they announced, as they were announcing some of the restrictions lifting, we're going to send everybody 2 kits a week type of thing. Like, is there anything like that going on?
I would say the Canadian government has been extremely supportive of our submission into Canada, and we certainly welcome the opportunity to talk to them about providing our test into the Canadian market. I can't comment specifically, but we've certainly felt like we've been very supported every step of the way as we've worked with Health Canada on our submission.
And when you look at it from a kind of bigger perspective, what do you think the true benefit of the test is? Like, how can it effectively help society or countries or cities or towns or maybe even NBA games, navigate the reality of the pandemic we're in right now?
That's a really good question. And I think most importantly, when you think about mitigating spread of rapidly spreading infectious diseases like COVID, it's really important to be able to test people and have an accurate result quickly. And I think the benefit of being able to have a molecular test like ours that can deliver truly a PCR quality result any place, anywhere in less than 30 minutes becomes very, very important to mitigating spread. I think it will take, continued efforts to increase vaccination. It's going to take continued testing. COVID has a very unique characteristic of being having quite a bit of asymptomatic spread, right? And so being able to test individuals who are asymptomatic and know that you have a result you can trust can be very important in terms of disease management and mitigating spread.
And we're dealing here, and I know some parts of the U.S. are as well, with the kind of rapid rise of variants of concern of COVID. How effective is this test in identifying those variants? Or not identifying, I shouldn't say the variants, but being able to test positive or negative if it's a variant case. My apologies.
Sure. I would say, we believe that our test is very effective against these variants. We actually do routine surveillance testing, and we keep a technical brief posted on our website. But we believe that our test presently is reactive to the UK, the South African, Brazilian, the Californian, all the strains that we've been testing so far. Our test is reactive to. So we feel very confident that whether or not a test will be effective relative to variants has to do with the actual targeting of the virus. Where are your genomic targets? And I think the targets that we have embedded in our test are actually not parts of the genome that typically tend to mutate, which is why it can be so reliable even against these emerging variants as they occur.
Gotcha. And just before I let you go, I think there's one real world example my producer pointed out, an NBA game in which this was used. Can you tell us a bit about that and how the test was employed there?
Sure. We actually just last Friday, we reopened Chase Center in San Francisco for the Golden State Warriors. Everybody coming into the venue either tested at home with a Lucira test kit or tested on site at the Chase Center prior to going into that game. So the state of California has put in place parameters that either require people be fully vaccinated or that they have a COVID negative test result. And so we opened the Chase Center last Friday, and then we were testing at the Chase Center again yesterday evening, managing the on-site testing for people going into that game. And it went really, really well. And I think it's a really increases, the safety and allows people to be together in public settings. And it was a very exciting moment for our company to actually have the opportunity to be opening Chase Center as well as receiving the Health Canada authorization all in the same weekend was a quite exciting moment for us.
And just one quick follow-up on that. Is it the NBA that purchased those tests and employed them? Like, was that a league-led effort?
In this case, it was actually the Golden State Warriors that purchased the tests. They've taken a leadership position in the FBA, and they actually included the cost of a COVID test in the ticket. They provided a free COVID test for every person that purchased tickets to the Warriors games.
Okay, interesting. Great. Thanks very much for making the time for this. I appreciate it.
You're welcome. Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.